This will not be the last pandemic. History teaches us that outbreaks and pandemics are a fact of life. But when the next pandemic comes, the world must be ready, more ready than it was this time. In recent years, many countries have made enormous advances in medicine, but too many have neglected their basic public health systems, which are the foundation for responding to infectious disease outbreaks.
India is certainly eligible, like all countries in the world, to be part of the COVAX facility, and discussions are ongoing in that regard. We, from our side, of course, would welcome very much the participation of India as a full member in the COVAX facility, both in terms of its extensive experience in vaccines, extensive experience in working together in the global scene in terms of childhood vaccination, other vaccines. India is an incredibly important player.
We congratulate the frontline workers and the communities in China for having reached such a successful outcome. But as we've learned in other countries, as all of us have learned, it's not over anywhere until it's over everywhere. And as you said yourself in your question, China continues to import cases from outside. So there's no room for complacency. And as normal life returns in many countries, and especially in China, there's always the risk that disease can flare up again, and sporadic cases can turn into clusters. Clusters can turn into community transmission, and community transmission can lead to overwhelmed health systems. We saw that happen in the earlier part of the year. We continue to see that happen in some countries. We need to avoid that happening again. If people are coming in to your country, in order to reduce the pressure on your follow-up systems, yes, countries could be, it would be a defensible thing to say we'll reduce the period of observation on travellers coming into our country. And again, each government has to set that period. Some governments are moving towards testing regimes, some governments are doing different things. So I do think that's, I won't say a flexible issue, but it's an issue in which governments have choices that they can make. But I would be, I think Maria is correct, contacts of confirmed cases need to be in quarantine for 14 days, and that's not something that we think would be advisable to reduce or adjust in any way.